The brain is actually covered by three meningeal layers: pyometer, arachnoid matter, and a dura matter. The pyometer is the most one, primary one. The second one is arachnoid matter. Third one is dura matter, and the external most outside one, right? So the area in between this pyometer and arachnoid matter, that is very important here. That is called subarachnoid space. The area in between, the space in between the pyometer and arachnoid matter, that is called subarachnoid space. Okay? Why that is very important? Because so this is called subarachnoid space. In this subarachnoid space only we have CSF. One thing. Second thing, we have all the major blood vessels here, especially the circle of Willis, which is present over here. We were speaking about this berry aneurysm now, right? Those berry aneurysm will actually happen a lot here only, like this. It will happen a lot here only. Okay? Because of this, there will be lot of hemorrhage will happen in the subarachnoid space. Okay? So what will happen when there is hemorrhage in the subarachnoid space? People will be having severe headache. Severe headache, especially they say the same word. What they will say? What happened to you? What is happening? Sir, I have headache. What type of headache do you have? They will say severe headache, thunderclapping like headache. I have never experienced this kind of headache. It is more worsened than the research clinical neuro class. So like that, it is so severe headache. Like that, they will explain. Okay, the worst headache I have experienced in the life ever. Like that, they will say. Okay, this is one thing. This is the primary symptom they will say. Why this is happening? Because there is a hemorrhage in the subarachnoid space. That blood will mix inside the CSF, mix with the CSF, and that is going to circulate all over. One. Because of that, see how this is happening. That may be because of trauma. So that may be producing indirectly any kind of infection, directly or indirectly any kind of infections or something. One. Second thing, because of that RBC mixture also, that may indirectly stimulate the ANS. Because of that also, because of these two reasons, any of these two reasons, it may produce general temperature rise also. So they may be having, second thing, fever also. First thing, they have headache, right? First thing, they have headache. Second thing, they have fever. For the same reason, what I have told now. The third one, what will be the main important sign for them? Any idea? The people will be having headache, fever, anything? Yes? Tell me, Bharat. Nuchal rigidity, nuchal tightness, nuchal line tightness. Yes. Nuchal tightness or rigidity. So what is happening actually now? This is stage by stage. Initially, there will be headache because of that initial bleeding, and that RBC, when that is mixed with RBC means erythrocytes. When that erythrocytes are broken down, it will be converted to erythroblasts, and that erythroblasts are the general responsible person for the stimulation of inflammation. Because of that breakdown, that may produce fever, or because of the stimulation of ANS, that may produce fever, or because of the infection also. Maybe one of these two reasons, any of these reasons, may stimulate fever. One. Second thing, because of that, there must be definitely any healing mechanism should come and reach over there. That is called chemotaxis. Okay, should come and reach over there. Because of that, the inflammation occurs. After that inflammation is passed over, the meningeal layer will go for inflammation. We call that known as meningitis. When actually the subarachnoid hemorrhage reaches the stage called meningitis, then the patient will be having nuchal rigidity. So this is stage by stage times nuchal rigidity, right? So these are the important things. First one is this, second one is this, third one is this. So you are receiving a patient now. You are receiving a patient with a severe headache, and you are asking what has happened. They are explaining a particular type of trauma, and you are observing, making the patient. Now he is fine. You are observing the patient. What he is saying, what happened after that hitting. Actually, I lost my consciousness for a few minutes. After that, I woke up and I came over here like that. They can say, so you have to wait for 2 hours. within the 2 hours, you observe whether there is any second loss of consciousness. If there is any secondary loss of consciousness, then definitely you have to go for CT, as we have already discussed. But in this subarachnoid hemorrhage, this will not happen. Subarachnoid hemorrhage is acute. Once in a hit, it will cause producing the symptoms, right? Once in a hit, it will cause producing symptoms. Okay, so subarachnoid hemorrhage, so acute. It's not like some other subdural or epidural hematomas. It is acute, and this will produce these 3 symptoms. And you are going to see in CT. In CT, can clearly see the subarachnoid hemorrhage within 6 hours. When you go for CT within 6 hours, you can easily find out. You have to correlate these symptoms plus the CT, plus if it is not able to find, you have to go for lumbar puncture. And after these 3 investigations, you can confidently say that it is subarachnoid hemorrhage or not. Okay.